Hi, it's Matt Kendall here today, and I'm doing an interview with an EMDR therapist because the biggest question I get asked all the time is what is the difference between IEMT and EMDR? And so I put a message out because I'm actually a member of some EMDR groups on Facebook and stuff. So I'm quite interested in EMDR. And Gabi very kindly responded to say that she would come and do this interview with me. And it turned out that Gabi actually saw me give a talk in Brighton last year, maybe the year before. When we were allowed to go out and, do things. And she's very interested in the eye movement work. So just give her a quick introduction. Gabi Metiu, Metiu, we've been practicing this. Gabi Metiu, yeah?
Yes,
Metiu. Gabi,
Matthew.
Matthew. Gabi is a
It's
clinical
okay.
hypnotherapist and she's also a registered nurse and she has over 30 years experience in the NHS and also in private hospitals. And then she trained in EMDR in 2019. Her specialisms include recovering from traumatic experiences, dealing with anxiety and mild to moderate depression, also work-based stress and stress management, as well as fears and phobias. And you can check out her website. I'll put links to it below, which is hypnolounge.co.uk. So welcome, Gabi. How are you today?
Thank you. I'm very well. Thank you. I'm very happy to be here and have a
Excellent.
chat with you.
Brilliant. Well, the way that this interview is going to go is we've got one, two, three, about 10, 12
Mm-hmm.
questions. And I'm going to ask that to Gabby, and she's going to answer the question from the EMDR perspective. Then I'm going to answer that same question from the IEMT perspective. All the questions are going to be timestamped below. And this is just a real insight because I know that there seems to be some sort of conflict I've seen online between IMT and EMDR, and also between some other eye movement therapies. I won't name anybody, it gets quite messy. I've never had a problem with different therapy types. I think that by understanding and learning how different ones work, it gives you the best advantage. It's I know that some, as Andrew Austin calls the alphabet therapies, the NLP, EMDR, whatever it might be, can often get quite sort of argumentative. I think that by learning from each other, it's the most beneficial approach. And I have plenty of EMDR therapists come and do the IEMT course, and I would love to do. I was going to do an EMDR, of course, this summer, but let's see what happens there. It's all to do with COVID. So, just to get us kicked off, can you give us a brief background on EMDR, who came up with it, and the development of it, basically how it's evolved to what it is today?
Okay, so EMDR, it was developed back in 1987 by a clinical psychologist, Francis Shapiro. From my understanding and reading, the development of this technique started 10 years before 1977 when Francis Shapiro developed um, an illness, cancer, and she was very interested and she was looking into in her focus was on the interplay between the mind and external stressors. And while uncovering memories, she noticed that they were accompanied by rapid eye movements. So this way it was kind of developed this technique. So initially EMDR was a technique back in 1987, but 33 years later is more of a psychotherapy, integrated psychotherapy approach. So it's a system of therapies.
Because I can remember reading, because I read some of the books by Francis Shapiro,
Mm.
that wasn't she out in a cornfield and she was looking
Yes,
along, and
it's what.
when she was thinking about a distressing thought and moved her
Mm,
eyes, she realised it calmed it down.
mhm.
If that's correct. So because EMDR is known as, because obviously you can get EMDR on like the NHS, and it's highly esteemed. Do you know when it was introduced into the NHS, or when that kind of when
Uh,
became like that at all, or?
I'm not quite sure, but probably not long ago because there have been quite few randomized clinical trials and
Mm,
a lot of data collection. And then probably 10 years later, probably it was introduced. I'm not quite sure,
mm.
but it's from what I remember.
Okay, because From IEMT, Andrew Austin, I actually did an interview. I'll link it below as well. I did an
Mhm.
interview with Andrew Austin about the origin story of IEMT. And essentially he's like yourself, he was a nurse, and he was working with I think it was neurosurgeons, I believe, at the time. And what the neurosurgeons were doing, they were getting patients to follow a pen, because they were using it to determine brain tumors, I believe, the size and location of brain tumors. And when they were asked to think about something, he noticed their eyes would wander off. And so Andy was asking them, I don't think he was meant to, what was happening when the eyes were wandering off. And they were saying, oh, I just lost the thought. I just lost what I was kind of thinking about. And so I believe this was also based on the work by Steve and Connie Ray Andreas as well, two very famous therapists from across the pond. So Andy started developing this kind of work. He started to work out where in time is this. So right, it's based
Mhm.
in memory. And he started developing this eye movement thing with with not students, but in little mini workshops. In fact, I went to a very early workshop. I don't know how long ago it was now. I think it was, I don't know if I was even living in London, maybe like 12, 13 years. And I can remember I went down to Brighton to meet this guy who I met on a forum. Sounds dodgy now, but he was also a therapist, and we were going to do
Mhm.
some work on each other. And he said to me, do you want to come and see this guy do a lecture about this eye thing? And I'd never heard of anything to do with EMDR. My background's in hypnotherapy.
Mhm.
And so I was like, yeah, okay. So we went along to a tiny little room, and I walked in and I met Andrew Austin, and he said to me, do you have a memory which just sticks out? And I was like, yeah, a negative one. Yeah. I said, okay. And he goes, hold that memory. And he just began to move my eyes.
Mhm.
And within a few seconds, he was like, okay, so when you think about that memory now, what's it like? And I was like, oh, wow. Because it felt like I was going back, just moving away from it.
Mhm.
And I was just seeing it in a very different way. And I was like, wow, this is fascinating. And he then formalized the 2-day training. And IEMT is really based on, I'll talk about this later, but these 5 patterns of
Mhm.
chronicity. And I think Andy says his biggest regret now is calling it IEMT, or saying it uses the eyes, although there was talk about changing it, but I think there was a lot of people saying, well, no, because that's how people know it, and it's
Mhm.
easier to describe it and people kind of know about eye movement therapies. And so I did the practitioner training, and I started using it with a lot of people because I was working in a coaching company at the time, and I was just given clients to work with. And I was getting fantastic results. And I wasn't even really knowing the full structure. So I'd like to say, no, I did the practitioner because I started using it straight away. Sorry. Then I did the practitioner training. And then a few years after that, I was invited to do the trainer training. So I went to do the
Mhm.
trainer training in Southampton a number of years ago. And then ever since then, I've been working as an IEMT trainer. So I don't really see many clients anymore now. I'm much more a mouthpiece of IEMT in a sense,
Mhm.
because you saw me give talks on it.
Mhm.
So before lockdown, I used to do talks all over the country. I still do a lot of webinars and stuff around it. And it's my aim now to get as many people involved in IEMT as possible, especially therapists. It's fine if you don't have any experience, that's fine. But if you're a therapist, it's just much easier, and you'll get more out of it, to be honest. So IEMT again really developed sort of by accident, just by observing something and finding this whole kind of body of work. And then it's developed out from this one eye movement thing to this model based on
Mhm.
these 5 patterns. And also IMT does have some other techniques within it as well, which I'll talk about a little
Mhm.
bit later. And so now it's quite a large community. We've got a lot of practitioners and quite a few trainers, and we're opening up in America and
Mhm.
India and Poland, I believe. And we're very lucky that although it's not, we haven't got like the whole NICE guidelines and things like that
Mhm.
yet. But where we are now is that recently, last year, I think it was last year, it was classed as a CPD course, continued
Mhm.
professional development course, which has been a real benefit to us, because now we can obviously advertise more to the medical and therapy fraternities, rather it just being a fun weekend. It's
Mhm.
like now an actual a real kind of therapy type. So let me ask you, I know that there's a lot of sort of crossover between EMDR and IEMT.
Mhm.
But essentially, what do you use, or what's EMDR predominantly kind of used for, and what kind of people do you work with?
Okay, so just like in your case, your Francis Shapiro regretted later calling EMDR EMDR. Should have liked to call it reprocessing therapy,
Mm.
but by that time it was already used under this
Yeah,
abbreviation, and it was just too difficult to change everything.
of course.
Um, and it can initially it was used for post-traumatic stress disorder, but these days it's used for all sorts of clinical complaints.
Mm.
So and it's mainly addressing earlier experiences, um, later experiences, or present experiences.
Okay, so because I've read in your intro that you deal with traumatic experiences, dealing with
Yes,
anxiety.
yes.
Can you give us any sort of examples of just some people that you may have worked with and how it's been
Yes, my
working for them?
first case, which I will always remember, not my first case, but the case I will always remember. It was a gentleman, it was referred by a psychologist. They said he had complex childhood trauma
No.
and he had years of therapy. And she contacted me and she said, we ran out of all the therapies. He suffers from a terrible nightmares and we just don't know what to do. So
Mm.
would you consider to do EMDR for nightmares? So I saw this gentleman 3 sessions. I combined EMDR with hypnosis, and after 3 sessions, they um, they were gone. So I
Mm.
had a beautiful email from him, and he's writing a book with his life, and one chapter is Gabi and EMDR, because
Wow.
he's still astounded how well it works, and it doesn't understand how it's
Mm.
working. Another lady came to see me for weight loss, hypnosis, and I just had this gut feeling that is more than just weight loss. So on the second session, I uncovered actually she was a victim of a physical attack and rape.
Mm.
So I integrated one session of EMDR and also hypnotherapy, and she had amazing results. Another client, I work on complex childhood trauma, and because it's got so many layers, we do address different parts, and that's why it takes a bit longer, as depending what you deal with. But you can work with nightmare, flashbacks, anxiety, depression, OCD, anything that can come from a trauma.
That's pretty cool, actually. And you say it
Mm,
might take a bit longer, but it's still only a few sessions
mm,
compared to traditional talking
yeah.
therapy. I don't know why I'm doing air quotes. Traditional talking therapy, which can take, well, years,
Mhm.
6 months to, I know some people have been in therapy for years and
For
years.
years.
And I always say, are you fixed yet? And I think that a lot of people get addicted to going to therapy
Mm,
and they're not
yeah.
necessarily looking for change. And I think EMDR is similar to IEMT, and it's not really a discussion about what happened. It's more about how we're changing, how it affects you now.
Mm.
And so I think it takes a certain type of client to want to change, because some people just need the counseling. They need to talk about the stuff. That's their way of dealing with it.
Yes, yes. You
With
have to be careful if there is a secondary gain,
yeah,
and where then you can use other therapies. You incorporate hypnosis or other therapies you
yeah,
are trained in. So that's why it's a system of therapies rather
yeah.
than just one technique.
Yeah, for those who are watching, don't know, secondary gain is like if you stop something, it's like the classic example is you stop somebody smoking, but then they start overeating, which is like the classic one. So, and it's interesting that you use, and this is what I find is that a lot of people do use multiple approaches. So you're using the way that I say that I use IEMT for the heavy lifting, and
Mm,
then I use hypnotherapy for like finishing it all off and packaging it
mm,
all up, as it were. So I don't use much especially now online. I don't really use much hypnosis at
mhm,
all. But when I was doing clinical sessions, I would do the work with IEMT. Then at the end of the sessions, I would put all the work we've done into a pattern
mm,
to solidify. Just give you an example with IEMT. So with IEMT, I've worked with a lot of guys who have had sexual abuse, mainly at a younger age, often within family or within institutions. So public school, football academies,
mhm,
sometimes work as well. And also children's homes. I've worked with a
Mhm.
lot of guys like this. And the reason why they're attracted to IEMT and also would be EMDR is that you don't have to talk about the
Mhm.
experience. And obviously, talking about the experience is one's very embarrassing for people, and two can often cause a lot of re-traumatization for the clients. With IEMT, I suppose the EMDR as well, I don't need to know the story.
Yeah,
Yeah.
you don't need to know the details.
No, I just need to know how it's structured and how it's affecting you and how it feels and what's going on
Mm.
internally. Just some examples of people who I've worked with. Now, I've done, if you go on my YouTube channel, which
Mhm.
you might be watching it now if you're watching this, IMT Academy, I do very extensive interviews with past clients. And so some recent ones that I've done, I did a fantastic interview with a woman who got divorced a number of years ago. We're talking 10, maybe 10 years ago. But her husband was still ruining her life in a sense. And it's not necessarily what he was doing, it was just the fact that he was still there. And
Mhm.
they shared a child, a grown up child, but they were still sharing. So they were still in each other's lives. And this woman has a new partner. And this partner was getting a bit sick of the hold this man still had over this woman. Um, excuse me, two others. This guy was like a real fun, happy, jovial, bit of a geezer, but actually was quite a manipulative, dark, sadistic, sort of cruel man to this woman. And there was lots of examples of where he was particularly, horrible to her. And so we did, I think it's 2 sessions. I usually do 2 sessions with a client, and we removed or we worked on all of these because IEMT works on two main things: memory and emotion. It doesn't work
Mhm.
on emotion, it works on imprints, but memories and emotions, and identities and relationships to others and identities of others. And that's what we really kind of focused on. And since then, she's just her relationship with herself, her confidence, and her relationship with him. She's just seen him as quite a sad man. And it turns out that he's actually quite afraid of her now because she's found her own
Mm.
confidence, her own strength. So that's been really amazing to see. So I love working with people coming out of relationships because they can be awful, and so helping people with that has been absolutely fantastic. I've worked with a woman called Mandy. Again, we did an interview. I didn't know what her condition was. She'd been diagnosed with PTSD by her doctor. She thought it was hormonal because she was of a certain age, and she put it down to that. But I worked with the woman who then spoke to, because I get most of my clients and stuff through referrals, and
Mhm.
she spoke to her, so she came to me, and she had some issues that were going on, and so we worked on them. And it turned out that she'd been sexually assaulted and her house had been firebombed, two separate incidences. And I didn't even know this until she told me. And we did this is all,
Mm.
this isn't confidential. This is all on YouTube. Um, and now she couldn't even be in a pub if they were playing rock music because it would make her angry. You can't be in a pub now anyway, but
Mm.
listening, and she was a rock chick as well growing up, and just listening, and she would be such an angry person. And now she's an EMDR, an IEMT, sorry, therapist.
Amazing.
Yeah, she came to do the course. She sees hundreds of clients a year. Mandy Bridge, you can check her out. She's a life coach as well. And just one last one is that I worked with this guy who was a very successful businessman,
Mhm.
and he had investors for a company. And what was happening is he wasn't being able to take on staff. And the reason is that in the past, he had this other company, his
Mhm.
old company, and his investors said, "We're pulling out. You need to make all the staff redundant." And this was a week before Christmas. So he had to go into a room of 30 staff who have worked tirelessly for him to say, "You're all redundant and you're not being paid for the last month," and all this. And he's a really nice guy. So obviously it just completely crushed him. So he's now in a position where he's not taking on staff. So his current business couldn't grow. So what we looked at was all this kind of stuff that had happened. And now his business is flourishing because he was able to let go and see things from a different perspective, from the
Mm.
investor's point of view and everything, without trying to explore that. That's what happened naturally. And so I do work with, I used to go to Germany, Berlin quite a lot, and work with these cryptocurrency people to help them better at business by finding these fears, phobias, anxieties, sticking points, and then using IEMT to smooth these over so you're not forcing anything. Because I'm not a fan of the motivation side of things. It's like if you find something and smooth it out, you don't need to have motivation. You know, it just helps you to do it. So let me ask you, what with EMDR, because this is what we were talking about the other day.
Yes.
There's quite a lot of confusion around who's a therapist, who's a practitioner, what you have to do. So can you please tell us what the actual training, the certification, the governing bodies, what do you have to do to become a practitioner or a trainer or a therapist? What's the differences from the EMDR community?
Okay, so there are different routes. So I'm talking about UK, USA, they are very strict. Europe, so there is a government body called EMDR Europe and EMDR USA. I think we belong to the one in Europe, I don't know now. So if you want to be a certified EMDR practitioner and then progress to a consultant, you need to be registered with MGI and you need to have a mental health background, psychotherapist, psychologist, mental health nurse, counselor.
Okay.
You can practice EMDR if you are certified and you have a certain background in a private setting. So incorporate EMDR within other therapies you are trained in. So I'm a clinical hypnotherapist and a nurse, and I'm certified in practicing EMDR, incorporating hypnosis. So I incorporate within my practice hypnosis, EMDR, parts therapy, so all the therapies I've been trained in.
Okay.
So it's depending what you want, where do you want to practice, if you want to be in NHS or you want to get referral from them, then you might need to be registered with MGI and have a mental health background. I have a special interest in EMDR and to work with trauma. So at the moment I'm training to become a psychotherapist counselor. So I will progress to MGI and being a consultant. So just attending a course doesn't make you a practitioner.
Yeah. And I think that's where the confusion lies. So just to make it crystal clear, you use EMDR, but you're not classed as an EMDR practitioner.
No. So I am certified. I'm a therapist. I incorporate the EMDR within my practice. But I can't call myself a EMDR practitioner because it's not regulated, it's unregulated in UK.
It's an unregulated industry.
But EMDR can come after you, because they are very protective of their brand. So.
And what was the governing body again? Just what was?
I'm with British Society of Clinical Hypnosis.
Okay, and what was the EMDR? Who would what's?
EMDRIA is called. EMDRIA.
Okay, EMDRIA. Is that international association or something?
Yes. So it's a Europe one, and then it's the USA one.
Okay. So and when they run a course or a certification, that's you need to have a mental health background as a psychologist, psychiatrist, what have you.
Yeah.
How long does it take to train with them? Do you know?
I don't know. There is different levels. So it's the basic training. And then from there you can progress and involve supervision, involve practice, a certain number of hours, certain number of clients. So it's a long process, and you have to pay annually fee to be registered with them.
To keep registered. And once you're registered with them, because obviously we're talking about EMDR and NHS. And you in theory you could work with NHS and you could get insurance referrals if that's correct. So at the moment you couldn't get insurance referrals with the qualification that you have, if that's right.
I am insured, but I'm working within the private practice.
Okay. So I think that's because your course, how long was your training? Your training was a year, wasn't it?
So it was continuing. Yes. I've done a medical diploma in clinical hypnotherapy, and then I've done a continuing professional development where I've done EMDR, I've done Gestalt therapy, so I've done various.
And specifically on the EMDR, that was it a standalone course or was it mixed in with other stuff as well?
No, a standalone course, specific for people, hypnotherapists.
Okay. Actually, for hypnotherapists.
Yes.
And you say
Yeah.
that was a year over a weekend a month, if that was correct.
No. The year was my medical diploma in hypnotherapy.
Oh, okay.
And then this was as a continual professional development standalone training. So it was a weekend after we completed.
Oh, right. It was just one weekend, was it?
Mm.
This is where the confusion sort of comes in. This is why I want to be really clear on it. It's like IEMT's a weekend as well. And I know people who say that, oh, I am an EMDR therapist. And I was like, are you? Because you're a life coach. And I'm not saying you're not a mental health professional, but I don't think you're a. And so I think that, again, it's a very sort of protective.
Yeah.
From the IEMT perspective, it is there's two levels basically. There's the practitioner training, and then there's the advanced practitioner training. There's no prerequisites to do the IEMT training. However, I do prefer people to be trained as a counsellor, a nurse, a therapist of some description. I get a lot of hypnotherapists. I get a lot of NLPers. I get EMDR therapists. And the reason why I prefer working with therapists is because they know about working with clients. They have experience and work with clients. I'm not holding somebody's hand from the beginning to how to actually work. Well, what happens if they cry or something? You know what I mean? We get rid of all that kind of stuff. They have experience. The way that IEMT works, it's a 2-day. I used to do a 2-day training, but obviously it's online. I now do a 3-day training, so it spaces it out a little bit more. It was a very practical course. You then do 2 case studies, which are basically you go work with 2 clients for 2 sessions each. I then basically assess and mark them. I have a Facebook group where I keep in contact with everybody, and then you join the association. And IEMT is its own certified psychotherapy, I believe. Andy Austin had to take all this to be put on to certain insuring bodies. So I won't name insurers, but they are with the major insurers, and so they will then, you can get your insurance just for IEMT, or like myself, it's added on to what you already do.
It's added to being a clinical hypnotherapist. I added EMDR and everything else that I'm doing. So you can take this route to get certified in EMDR if you are a hypnotherapist, because you need to have certain knowledge how to stabilize a client, how to deal, to teach him coping processes. So you can take this route as a hypnotherapist to train in EMDR and incorporating within your practice. So it's exactly how it's called, EMDR incorporating hypnosis. If you want to take it further, then there are different levels depending where you want and what you want to do. If I was a counselor or psychologist, psychotherapist, and not necessarily EMDR practitioner, but I was like doing I was learning EMDR, but not to that level with Andrea. I could still get referrals, see clients, and incorporate within my work EMDR. So there are various ways, but you need to start from somewhere. You can't just go and I'm going to train in EMDR. Well, it's just not possible.
The things, because I was going to do a day course. Which I know, and at the end of it, it's certified by its own little governing body. I just thought, or if I went to do a day course on EMDR, I wouldn't necessarily advertise. It was just to be for my knowledge more than anything, Okay, let me ask you. So with EMDR, I've done a bit of research on it about the different phases and stuff like that. What is the structure? So you're working with a new client. What are the structures? What are the sessions? What are these phases? How do you work with a client with the EMDR structure?
Okay, so EMDR is not one session therapy. It's depending what you deal with. There are 8 phases within a session. sometimes if you can use your judgment as a therapist, if that client is stable enough that you can take the history assessment and do the therapy within the first session, or you need to prepare the client for the therapy. So the 8 phases, let's say I've got the client, I create a great rapport with the client, is prepared, I've done the assessment, everything. So the session is the first session. So it's the history.
Yeah.
Is history taking because there are some contraindication to EMDR. If there are any eyes problems, epilepsy, neurological disorders or problems, brain damaging. So there are few contraindications. So you take history just to make sure that the client is appropriate to do EMDR. And also presenting problem. What is that? Is the, because you need a target. You work one target per session, one trauma per session.
Okay.
So is history taking. Then second is assessment, preparation. In this phase, so like 3, preparation. If you are training other techniques, or you think that is necessary, you can incorporate a bit of hypnosis to get them to a safe place, or you can do parts therapy if you think that is a bit of dissociation. So at this phase, you can incorporate other therapies.
Okay.
Then you do you need to find out what is the target. So it's a memory with a negative emotion, sensation, an image, a negative belief. So you find out the target, what you are going to work in the session, and where is in the body. So I think with EMDR, you work more on emotions, sensations in the body. Where is that node? Because when you think, you target a memory, an event, a traumatic event, you might have a picture in mind, you might not. You might have a cognitive belief, you might not. And you feel somewhere in the body. You just feel something in the body, and you work on that one. And there is a continuous question. So what are you noticing? What is going on? What are you noticing? What is going on? And you do desensitization. So you do the eye movement. Then you do the rescan to see what is going in the body, closure and reassessment. So is a structure you follow.
Now, may I ask, with the
Yes.
different phases, because you do it for, so one trauma has all those phases.
Yes.
So you might do in one. So let's say your first session is a history taking. So the second session you're going to do the work. Could you, in theory, do all of those phases in a single session?
Yeah.
Okay. Right. Okay.
Yeah.
And then if they come and see you again, you would rinse and repeat and go through all the phases on the second trauma.
Mm-hmm.
Okay. Okay. Cool. That's interesting. And so the phases, could you just say what the phases were again? So you started
Okay,
with the history.
so I'll just have them here. So I just
Perfect. You've done your
history,
homework.
yeah, history taking,
Okay.
then preparation, then assessments. So assess the target, the memory you are working on, the presenting problem. Then 4 is desensitization. So you start the eye movement desensitization. Yeah. Then you go to installation. So you put the positive cognition. So people might come with I'm not good enough, or I'm not safe, or I'm not lovable, or I'm not enough, whatever negative cognition. And you process and install a positive cognition. I am lovable, I'm good enough, I'm safe, I'm in control, I'm okay. Whatever is coming from them, a positive statement. And then you do a body scan just to see what's going on, how is his processing, closure, and then reevaluation at the end.
Perfect. Can I ask you, with the body scan, is that kind of like the mindfulness technique of you go through?
No. So we work on something, and then okay, so what's going on, what are you noticing? So this is a constant question. So just take a nice deep breath in and out, and what are you noticing, what's going on? So they are just paying attention in their body, if it's, if there is an emotion, a sensation, a feeling,
Okay.
a discomfort, anything that's going on. So is you are targeting anything that is blocked in the body.
Okay, let me ask you. So say that I'm a client right now, and you say,
Yes.
"What are you noticing?" And I say, "I'm noticing a strange feeling in my stomach."
Okay.
How would that then work?
I'm not looking for a description.
Okay.
So I'm just looking, what are you feeling? And I don't want you to tell me something just to tell me, just to tell me what's going on. So you could say, I've got a headache, or I feel a pressure, or I feel my stomach is like this, or lots of clients, they've got something in their chest, and then it's just moving towards their ear, and then it's
Okay.
just going out because it was something they heard, and it went straight to their heart. It's very, so emotions are fluid, and they are just changing and moving. So you work on those emotions
Oh,
to,
okay. And how do you work on those emotions then? Do you just do more of the eye movement, or what's the
yes,
actual?
yeah,
Okay.
yeah. So it's like, just think of the body healing capacity. So if there is a blockage somewhere, it stops the healing. Like, say it's a foreign body, you are injured, and there is a foreign body
Mm,
somewhere, it just blocks the healing. Once the
yeah.
foreign body is removed, the healing resumes. So it's the same way with EMDR. There is a blockage somewhere, so the traumatic memory is stored in the wrong place, is not uh, processed properly.
Mm.
It just feels like it's current and it's happening in present.
Oh, okay.
So when you remove that blockage, then with each set of eye movements, you move that one to the correct place where we store the long-term memories. So you discard
Mm.
whatever is unnecessary, the negative emotions, anything that is attached and is impacting your life, and you keep what is useful and the learning, and what you can use in the future.
And you're trying to install a negative, a
A
positive belief.
positive.
Where okay, because
Yeah.
IEMT is I think this is where I think there's sort of two main sort of big differences between IEMT and EMDR. Uh, EMDR result has this phase system, which
Mm-hmm.
IEMT doesn't,
Mm-hmm.
and EMDR is trying to install a positive,
Mm-hmm.
and IEMT isn't trying to install a positive. IEMT is based on what we call the 5 patterns of chronicity. So why has this client stayed stuck with this problem? And so there are different, I won't go through all of them, but basically sort
Mm-hmm.
of being an effect or a cause. So are you doing life, or is life happening to you? So the complainers, this happened and that happened and this happened and that. Well, what are you doing? So we try to put people into a position of control, or people who abreact, and that's generally to do with other people's behavior as well. So we're trying to determine how this person is acting in life, and to where to we then use these eye movements. Now, when we've got different sets of eye movements, and essentially what I do is I send a new client, an assessment form, um, and I'm going through how they describe the problem, how it's affecting their life, and I'm looking for things like negative memories, negative emotions, identities of themselves, and identities of other people. So they're the 4 key things I'm really looking for. And the last things I'm looking for, these patterns of chronicity, and how they're staying stuck within this problem, basically. So I would do an assessment like yourself, and then I'd usually have a pre-talk with somebody. I'm doing this all online at the moment. I'm sure you are. It's one of the
Mm-hmm.
questions later, but I know we
Yes.
do it online now. And we always start off with a demonstration. And so we have what's called a simple and a complex pattern for the 2 things
Mm-hmm.
that we do. So we have a straight line protocol and the infinity loop, or lazy 8, whatever you want to call it, the synchronization movement. Um, and so we do a straight line on the what I call like a static or a standalone memory.
Mm-hmm.
And then we use the complex pattern on, now IEMT does not work on emotion. It works on memory. So where EMDR sounds like you're
On
looking for emotion.
emotions.
Yeah.
Mm-hmm.
IEMT doesn't work on emotion. The way that I say this is that uh, emotion is produced by memory. It's like having a speaker and music. Okay. So the music is being produced by the speaker. So in IEMT, what we're doing is we're looking for the emotion, and then we're then finding the speaker that's causing the emotion. We
Mm-hmm.
then work on that memory. So we work on the memory that's actually causing the emotion. So what we do is if somebody comes to me and they're having lots of guilt issues, we would get them to rate that feeling of guilt out of 10, how familiar, and when's the first time you can remember
Mm-hmm.
feeling this way. And we go to the first imprint of how they learned how to feel this sense of
Mm-hmm.
guilt. Once we get the imprint, and it's usually stuff from school, parents, it's always goes back to that kind of stuff,
Mm-hmm.
we then get them to hold that memory for as long as they can until it changes. And we're getting them to basically let go of the imprint. And we then reassess the imprint. And this takes seconds. It's not a long thing. And then we go back to our calibrator. So our first calibrator is the memory that we've worked on. If there's anything left, we simply do it again. And then we come back to the calibrator, which when you
Mm-hmm.
think of guilt now, how strong is this feeling of guilt? Now, if that feeling remains above 3, we will then repeat the process to go to the next imprint, which we will do for a maximum of 4
Mm-hmm.
times. And that's essentially how we work. So if specific static memories, when I say a static memory, it's just a negative memory that comes out, we get them to hold the memory. We go to, on 3 lines or on all 3 axes, hold that memory, reevaluate it, and then reevaluate it. If it's an emotion, we use it to go back to the imprint.
Mm-hmm.
Then with the identities, essentially, if somebody has an identity of, I am afraid, okay, there's a couple of ways that we can work on this, but generally the way that I would work on this, the easiest way to teach this is, and when's the first time you can remember being this way? So not feeling, because I feel afraid and I am afraid are 2 different things. So I feel afraid as a feeling, as an experience, and I am afraid is a way of being. And so we take them back to the first time they can remember being this way. And this will tend to be more a period of time as
Mm-hmm.
opposed to a one-off imprint event. It tends to be at school or at home, and we get them to hold the experience, and basically we then use the
Mm-hmm.
circular movement. And what it does, it allows them to have what we call age progression. It allows them to come out of it to where they are today.
Yeah.
And it's amazing to watch. And that's kind of the basis of IEMT. We've also got, I'm not going to go into it just because it's not really relevant today, but we have like a PTSD model that we use. But and we have a body language thing as well, how people access a problem physiologically, and how we encode time and how we add time on to bring them up to today. But the way that essentially that we work, when I teach therapists, I teach it as a 2-session protocol.
Mm-hmm.
And in the first session, I'm getting them to work on the negative memories a client has and the negative emotions the client has to find the imprints. Then in the second session, we're going to look at the identities. It's an I, me, self, you protocol, and the identities of other people. I did a fantastic one with a chap who's on my last training who has his father-in-law is not his favorite person. So what you do is you get them just to think of that father-in-law or that person. You bring what comes to mind and hold that as you begin to move the eyes around.
Mm.
And how it changes is just so, you came round, and it's remarkable.
Yeah, it's the same with the EMDR. I think it's an overlap because some people, they know exactly what happened, so they remember the memory. Other
Yeah.
people, they don't remember. They feel in a certain way in the certain situations. Other people, they've got, like you say, identity. We say a negative belief. So
Okay.
we can start with presenting problem, and then from there we go to an initial event, or if some people, they don't really remember, but they still can process. And what I've noticed with my clients, So one session of EMDR, the first one is 90 minutes. So 30 minutes history taking and all the pre-talk and everything. And then the therapy. The next sessions are 60 minutes. But I've noticed if I work few sessions with a client, the therapy, the time is shorter and shorter because
Yeah.
the brain is learning how to process. It just goes straight there. It's like I'm doing a set of eye movements and like, yep, I know. It's just there
And I
straight
think,
away. So the brain is learning how to
and
process.
that's what definitely I found as well. And what I
Mm,
definitely find as well is in the first session, people are quite apprehensive because this
mm,
is, they're not used, if they've either had counseling therapy or no therapy.
mm,
And this is an actual, it's not physical therapy, but it's, you're doing something
mm,
with them. And what I definitely find, and this is what my practitioners report, that once somebody's had a session, the next session they're coming, right, let's go, because they've had the experience of that
mm.
first session. So in the second session, they're much more willing. In fact, let's move on. The next question actually
Yeah.
here is with the actual eye movements themselves. So you use, I know in EMDR you use more than just eye movements. Can you tell us about the eye movements that you use and the tapping and the sounds and the other thing you
Yeah.
incorporate?
So we use eye movements. We can use tapping, alternate tapping on the back of the hands, or audio,
Mm,
um, any sound, alternate sound
yeah.
to the ears.
And that's
So
just
you
like a
can use
beep,
any
beep,
of
beep,
these.
beep.
Yeah,
That's, yeah, yeah,
yeah,
yeah.
yeah. Because some people they are more visual, some people they are more auditive, some people they are very tactile,
Mm,
kinesthetic. So it's depending. And when you are doing the intake with them and the pre-talk, and that you ask them how does it feel for you, the distance, the speed, do you prefer this if it's in person. Now I'm working online, so they do self-administer EMDR, so I just guide them
mm.
through the process, but they are doing the tapping.
Cool. And do you have equipment for, like, because I've seen you can get like tactile
I don't
pads
have
and
equipment. I don't have equipment. So I'm just using, if you see face to face, is just literally eye movement, tapping, or I can do tapping a bit louder so then you can hear. You can even use two pens and you alternate a different sound. So you can be very creative, but there are different platforms and different
yeah,
things you can use.
yeah, I've seen some of the equipment. So when you're doing the eye, because I've seen EMDR therapists, it seems to be more of a wave than anything. Because with IEMT, what we're actually doing is we're actually doing a straight line from one to the periphery to the other. So is that what you're trying to achieve, or are you just trying to make it? What is it you're trying to do?
No, it's just straight line.
Oh, okay.
Well, you can ask the client how is comfortable for them. You can use like an infinity. You can
Mm.
use this way or this way. It's a straight line. It's just you just adjust. You see how the client is doing, how he's progressing, and the speed and everything.
And you do it's 24 double, so it's 48 eye movements.
It's 24 one complete movement. So
24.
this is one complete, yeah.
And when you're doing the eye movements, what is it you're looking? Are you looking for anything, or are you just going to do 24 regardless?
We are just looking to process whatever is going on, whatever they are experiencing. That's why they are coming. So we start the first set. We focus on a target, on a node in the body. So they say, okay, I just feel this in my chest. Okay, just go with that.
Okay.
So they ask them, is constant refocusing, or you constant ask the same question and ask them to focus. So you do the eye movement and then you ask them, okay, now take a nice deep breath in and out, and just tell me, what are you noticing? What's going on? What's changed? So they say, okay, I don't feel here, but I just feel something here on my shoulder. Is like, is a weight. Okay, go with that. So we do another set. So we kind of move the memory from amygdala or reptilian brain or wherever is stored to hippocampus, where is the long-term memory in the brain.
And do you have a set number of movements you would do on a problem? No, you just
No,
keep going until. And then
You
do you
you
do?
see, you see, that's why I love EMDR. I
Yeah,
absolutely love, and I'm in love with EMDR. It's very tangible. You see it with your own eyes. It's
yeah.
like happening there. I mean, it's just so rewarding. And it's when you see it, people are coming, they are like the body posture, the
Oh yeah,
language,
yeah,
everything, demeanor. And then at the end of the session, like, oh my God, I'm just like, it's been, they sometimes
yeah.
they're crying, but they're happy tears because it's very tangible
Oh,
what
oh,
you achieve.
absolutely. And when you're in the installation phase,
Yeah.
are you using eye movements whilst doing the
Yes.
installation?
Yeah. So I say, okay, so we process and we go, we reduce, because we are so on a scale from 0 to 10, sad, so scale unit distress. You ask, where do you feel you are, how distressing is the memory or the whatever they experience, and they say a number. So you try to reduce it down, and you continually checking with them where they are. Some they go to 0, some they go to a neutral place, some they go to a 2, and you say they are happy.
Okay.
So whatever is good. Okay, so now with the positive cognition, again we measure. So we say on a scale from 0 to 7, 0 is false and 7 is true. Where are you with positive cognition? I am okay. Where are you? And they say, well, I'm a 4. I don't think it's false, but I don't think it's completely true. So I say, okay, go with that. So you do the eye movement, the sets, and then you check with them. So what's going on? What are you noticing? What changes? Now it's a 6. Okay, what is stop, or a 5? Okay, what it stops being a 6 or a 7. So you keep
Okay.
going till it's 7. And when it's 7, it's like completely installed the positive cognition.
Very no, very interesting. It's
Mm.
excuse me, with IMT, we have two eye movements.
Mm-hmm.
We do the straight line. So what we're doing is we're trying to get to the all the quadrants of
Mm-hmm.
the eyes, basically, all the different axes. When we're working on a static memory or
Yeah.
just a standalone memory, we do 6 on each axis. So that's 1, 2, there, 3,
Mm-hmm.
4, up to 6, and then and we do that each way. Now, when we're just doing static memory, I'm not really looking at. I'm watching the eyes, but it doesn't
Mm-hmm.
really matter. What it's more important when we do what the complex or the integrative or the integrative, and that's when we go back to the imprint. And what we're doing here is we're moving the eyes until it runs clear, until it stops deviating. The deviation is, the moving away from the line that you're doing. And so I'm actually looking for the deviations to basically, the way I think about it is like I've got like a little iron and I'm just smoothing it
Mm-hmm.
out. And we do that for up to 40 seconds on all the axis. I'm just literally smoothing it out.
Mm-hmm.
And then I retest and I redo if necessary.
Yeah.
With the infinite loop, now what we've found, and this is up for debate,
Mm-hmm.
straight lines work better on memory and the curved lines work better on identity. So the basis of identities. So I won't go through the I, me, self, you, because that's like a lot of the training. But
Mm-hmm.
we, with identity work, we go to the first, or belief systems as well. This is what we call belief systems.
Yeah.
So say I am a failure. When's the first time you can remember being this way? Hold what that's like. Hold that identity, and then you actually just start to move it round and round. And again, I'm looking for when that runs smooth, and then we simply begin to
Yeah.
reverse it, and we do that 6 times either way.
Mm.
And the way that IEMT works is that I like to think of these different things as like the eye movements as like a punch and a punch and a kick and a kick in like a in a martial arts. So if I'm doing with an identity work, if I'm doing this, and if a really
Mm.
negative memory comes out, what I will do is I will then use the simple pattern on that memory.
Mm-hmm.
I will then come back to doing that identity work. Or if I'm doing the identity work and a very strong emotion comes out, I'll work with that emotion to the imprint with the integrative pattern. I'll then come back to the identity
Mm-hmm.
work. So with IMT, we have very specific eye movements for very specific things, but we only move one step away from what we're doing.
Mm-hmm.
Okay. And I need to rush slightly. This has gone on. I could talk to you for hours. So basically, how do you think? What are the benefits of having? Oh, how does IEM or how does EMDR? Sorry, um, in your training and stuff, what's the actual sort of definition of what's actually going on? Because I know it's talking about reprocessing. So in your training, what was it sort of described? What's your understanding of what's actually happening? How does it work?
Okay, so the brain is called brain's information processing system. Like in a natural way, it's process information to a state of good mental health. And in trauma and stress, this is unbalanced. So EMDR is like a reboot to the nervous system
Okay.
to process correctly an event, a memory. So the change is at the neurological level and the outcome is at the cognitive level. Because like you said, something happened early years, and we, through our eyes as a child, everything was magnified and it's like a frozen moment in time, with emotion, with everything that happened in that moment. And that remains in unprocessed, and years later as an adult we are still seeing that experience through the child's eyes.
Yes.
So by moving the experience and processing, and we managed to detach from those negative emotions, get rid of them, and just maintain the learning, what is useful in the future, and just seeing from an adult point of view. So
do you know that's from in the IEMT training, we although we talk about the different brain parts, in the actual training, there's no actual explanation given. And the simple reason is that we don't know. We're hopefully, now obviously the corona and everything's kind of thrown this a bit, but we were looking to do, the association was looking to do work with people whilst being, I think, with bioneurological feedback, and also in a scanner of, I don't know if it's MRI or MRA, whatever it might be, just to see what brain regions and organs are actually lighting up. Now, I've done quite a bit of research in this in terms of trauma and the traumatized brain. And I've been lucky enough to have a whole range of different mental health professionals, nurses, doctors, and neuroscientists who've actually come on the training. And from what my understanding is, now this is just not my, this is not IEMT, this is my understanding. When you take on a traumatic memory, you have there's two things that's going on in the limbic system, the main things, with the amygdala and the hippocampus. The amygdala is the regulation of the fear, the emotion, and the submodalities, so the quality of the memory. And the hippocampus is basically the sorting system, so where it puts it into long term. Now, when you're under stress or there's a lot of emotion in a situation, the amygdala improves its function, but the hippocampus decreases its function, it's impaired.
Yes.
The way I describe this, imagine you have a library, you have a librarian at the front desk. If you come in with a book, the librarian takes that book and goes and files it. All right? So the amygdala is like the person coming in with the information, and then the librarian's really like the hippocampus. If you're bringing one book in at one time, it works really well. If you bring in loads of books and just dump them, the hippocampus or the librarian cannot cope, and they end up just on the floor and unsorted. They're just like left open. And these emotions or these experiences can be re-triggered. These imprints can be triggered in our life today, and you're regressing back essentially to that person of that experience. So with IEMT, one of the main things that we find is what we call age progression. So you're allowed to go back to this sensitizing or this imprint, and you get to see it from who you are today. So something that happened to you when you were 7 may have been traumatic for a 7-year-old, but when you're 43, it's probably not going to, if somebody steals your pencil at school, it's probably not going to bother you.
Because you are seeing that one through emotions, but when you do the processing, you see like from, in a rational way, logical way, through your adult eyes. And this is the amygdala in a like baseline, and this is an amygdala with lots of stuff in it. So you are not the baseline. So these are all the unprocessed memories. They are still there. So when you take them out, and you move them towards the hippocampus,
Mm.
then amygdala goes back to like the normal. So
That's
otherwise,
interesting. Yeah.
so it goes when you go, if think it's danger, fight, flight,
Yeah.
froze, and amygdala goes this way, and then when the danger is over, it just goes to the normal state. But when
Interesting.
you've got there something, it doesn't go back because it's got a lot. So amygdala in a traumatic people with a lot of trauma is it looks different, and
Yeah.
hippocampus is not so developed.
Yeah, no, I've seen this. I've seen that, especially with children from war-torn countries,
Yeah.
their amygdala is larger because of all the trauma they've
Yeah.
experienced. I just have a few questions left. Sorry, I've got another interview too. What are some of the key benefits of having EMDR? So a client comes to you, they're in a state of trauma. What are just some of the key benefits they will experience by having EMDR?
Well, it just facilitate a speedy progression towards health in a, let's say, is a therapy with great results in a short period of time, and it can be used in lots of clinical complaints. It can be used trauma. It can be used with any other symptoms. It can be used. I incorporate, for example, weight loss for cravings, quit smoking for cravings. So it can be used, integrated, and it just is a beautiful, gentle way of processing traumatic memories.
Perfect. With IMT, I think some of the benefits, one of the biggest thing is it puts the client back in control of their
Yeah.
life. So they're not reacting to the
Mm.
world. That they can basically make their own decisions based on the information that's in front of them
Mm-hmm.
and not the emotions and the experiences of the past. And that's what I find tends to be the biggest thing. So it's not with IMT, I didn't really mention, but we're not trying to put any kind of positive emotional belief. IMT only works on stuff that's negative. So we're just focusing on negatives to then work on those negative imprints. Because we find that if you work on negatives and relieve the negatives, you don't need to make stuff positive.
Mm.
That's kind of our sort of philosophy. If you just work on the negative stuff, everything's generally okay. So that's what IEMT really is. It's an exploration of the problem, and we don't actually offer an outcome. So we don't say I will make you feel or I will give. All we can do is explore the problem.
Well, you don't give an outcome, but they access their resources. Basically, you facilitate them accessing internal resources and just process something in a healthy way. So then
Yeah.
you don't carry with you, because how I explain trauma to
All
my
right.
clients. You are just here. You are stuck there. This is trauma.
Okay.
So then you just by processing those emotions, negative cognition, whatever is sensations,
Hmm.
you can just get out from here. But this is the feeling stuck.
Yeah. Oh, this is no. I completely agree. And feeling stuck is
Just
yeah. No.
moving. When you are moving, you trick the brain into like you are moving forward. You are not stuck where you were.
Absolutely. Now, I've had a couple of questions put to
Yes.
me. Do you think if it's important for the client to know the details of the traumatic incidents themselves, and if so, why?
No, no, it's not.
No,
No, it's not.
I agree with IMT. What I'm looking at is how it affects the person today. Although what I have found is that when you work with somebody on a traumatic memory, when they step back from it, they can see the bigger picture, and they often realize a lot of this stuff was not about them. That's what I found in general. But okay, you do it on. So can you do EMDR online?
Yes, yes, yes. We moved online, and it's working really, really well.
Yeah, no, I started doing IEMT online because some of my clients are abroad, And so I prefer to do it. So I had the
Mhm.
clinic, well, I have a clinic, but in London Bridge.
Mm.
That's in London, if people know it from there. Where I see one-on-one clients, where I do all my
Mm.
trainings, but I have moved everything, even the trainings I've moved online,
Mhm.
and that will be for the foreseeable future now. How important? Okay, so how important are the eye movements, tapping, and sounds in changing the issue? So by that, it's Andy Austin was talking about how much change a person could actually experience just by accessing the impulse or the problem and thinking about it, as opposed to an intervention. So I know it's a bit of a weird question, but how important do you think the eye movements, tapping or
I
sound
think
is?
it's a component of the
Yeah.
therapy.
No,
So
do you know what? I agree. It's like one of my friends is a GP, and he says the things, if you're accessing a negative state or memory or anything, doing anything will cause some form of change. Listening to music, changing your body
yes,
posture, or going for a
exactly.
run.
Exactly, because they say some scientists thinks with EMDR is the same like the REM, the eye movement, the
Yes,
REM
yeah.
sleep, and also other they just think by focusing on the traumatic event in the same time with an external stimulation, it's just interrupt the pattern of the working memory, which is where the traumatic event is stored.
Yeah, I agree. I absolutely agree. So, just like a quick summary. So, from my
Yes.
understanding of speaking to you from EMDR, EMDR is primarily used for PTSD and negative memory.
So it's for traumatic, post-traumatic stress disorder, complex childhood trauma, developmental trauma,
Okay,
and lots of other clinical complaints.
okay. But essentially, the main thing seems to be the trauma and the release
Mm,
from trauma. Okay. It's an 8-phase system.
mm,
Um, you're looking to reduce the target, whether that be an emotion or a memory. You're looking to reduce that, and then you're looking to install the positive, or what I think is the positive
mhm,
you call it. So you're
mhm.
looking to install something up to a cognition level of 7, where they believe that to be true.
It's a positive
A,
cognition,
a
yes.
positive
So
cognition up to
instead
7.
of negative cognition, you reprocess the memory and you install a positive cognition.
Okay. With IEMT, the main work is based on these 5 patterns of
Mm-hmm,
chronicity, and there is a video on this on my YouTube, which I'll go into more detail.
mm-hmm,
We do use it for PTSD. We have a whole PTSD model.
mm-hmm,
We also use it for we don't, and EMDR works on emotion as well, doesn't it?
mm-hmm,
IEMT does not work on emotion. IEMT just works on memory, because that's is producing the emotion. So we're
mm-hmm,
looking more for the imprints rather
mm-hmm.
than so we don't do any body scans or anything like that. Okay. IEMT has 2 main eye movements. We have one for memory and emotion, or the imprints rather than emotion, and the identity, so their way of being and their relationship with other people. And also in IEMT, it's got a few of the techniques in
Mm-hmm.
there as well, which kind of rounds it off. So from my understanding, IEMT, we call it a technique more than a therapy, I suppose.
Mm-hmm.
EMDR is a longer process, or
It's
tends to be.
I think is a system of therapies. I
It's a
think it's
system
an
of therapy.
integrated psychotherapy approach.
Yeah.
Because dealing with complex childhood trauma, you need to have understanding and then integrate various therapies. So I think is just correct. You can use it in one session for a single event,
Mm.
but it's depending on the presenting problem. So I think there is a more of a therapy system of therapies.
Perfect. So the main thing is, and the other big thing as well, learning EMDR, if it's not done through EMDR IA, you're not an actual practitioner. You're just somebody who uses EMDR, but you can't do NHS or insurance work, but you can still use it in combination with the therapies such as clinical hypnosis.
Yes, so I am insured. So
Yeah.
I'm insured as being a hypnotherapist and doing EMDR and other therapies.
Mm.
Um,
Or you're
but
insured to
it's
do it,
just
but
it,
you're not through the EMDR IA, is what I mean.
yes. So
Yeah.
it's not going into like NHS. You just need like I am a nurse.
Yeah.
Yes. So I came here to UK. I am a nurse in my country. I'm a nurse in Germany. I want to work here. I need to go through a process to register and this is the same. You need to go through a process and to be registered with them, and then to call yourself a EMDR practitioner and being able to get referral from NHS, police, or whatever public institution is. You can integrate it and using it as a technique. So you could be a counselor and you learn EMDR, but you are not necessarily an EMDR practitioner.
Yeah.
And you can integrate it in your work. So there are various routes, various ways, depending what you want, who you are seeing. So it's just
Perfect. Well, thank you so much. Hopefully for the people watching this, that's cleared up
Yeah.
some of the differences between to do the what do I do? IMT. It's a 2 or 3 day protocol training. You then do some case studies afterwards. If you want to contact me, you can just email me at matt@iemtacademy.com. And Gabi, your website is thehypnolounge.co.uk. I will link it below. Thank you so much for your time. I could continue speaking for so much, but I'm actually doing an interview with somebody who did the practitioner course. I'm going to go do an interview with her to see how she's been using IEMT in combination with coaching with her clients. So I will, no doubt our paths will cross again in the future, but thank you very much.
Thank you. And bye.
Bye.